So let's see about the major histocompatibility complex. So far we have been seeing, we are repeatedly hearing this name MHC, right? So what is this MHC? So it is also called as the human leukocyte antigen. HLA, it is also called as HLA or human leukocyte antigen. So the gene for this MHC or the HLA gene is going to be present on chromosome 6p. Okay, chromosome 6p is the region wherein we have this HLA gene. So in this HLA gene, we have three parts, which is 1, 2, and 3. Okay, so under the first part, we are going to have subunits called as A, B, and C. And under the second subunit, we are going to have DP, DQ, and TR. Okay, so this subunit of this HLA1 is going to produce this MHC1. Okay, while MHC2 is going to be produced by this HLA2 gene, DP, DQ, and DR. And this HLA part 3 is going to produce something called as C1, C2, properdin, TNF alpha, and heat shock proteins. Okay, so various complement related proteins along with TNF alpha and HSP are going to be produced by this HLA component 3, which is MHC3 basically. Okay, so there are differences between this MHC1 and MHC2, which is mostly important for us. So MHC1 is going to be present on all nucleated cells. So any cell in the body which has a nucleus along with the platelets. So platelets usually don't have nucleus, but still they express MHC1. So the exception, so what cells do not express MHC1? It will be RBC. So RBCs again, they don't have nucleus. Platelets also don't have nucleus, but they still express MHC1, but RBCs don't express MHC1. Okay. Then with the help of MHC1, it will be presented. So in the context of MHC1, this it is going to be presented to the CD8 positive T cells, right? So in order to detect this MHC1, you can use allo antisera. So all of these has been asked as questions. So allo antisera is the method by which we are going to detect the MHC1. Now coming to MHC2, this is going to be present on all the APCs. Okay, all antigen presenting cells are going to express this MHC2. Then when APCs are going to have this MHC2, they are going to present it to the CD4 positive helper T cells, right? So this MHC2 can be detected by a mixed lymphocyte reaction. So this again is a question. So MLR is for detecting MHC2, while allo antisera is for detecting the MHC class 1. So now let's see about the structure of MHC1 and MHC2. So this MHC1 is going to have 3 subunits, which is alpha 1, alpha 2, and alpha 3 chains. While this alpha 1 and alpha 2 is going to form this cleft wherein this antigen is going to bind. So this alpha 1, alpha 2 forms the antigen binding site of the MHC1 complex. While this MHC2 is going to have 4 chains, which is alpha 1, alpha 2, beta 1, and beta 2 chains. And here the antigen is going to bind to the cleft formed between alpha 1 and beta 1. So the antigen binding cleft of this MHC2 will be alpha 1 and beta 1. So for MHC1, antigen binding cleft will be alpha 1, alpha 2, while for MHC2 it is going to be alpha 1 and beta 1. So whenever the patient is having certain HLA genes, they are going to be susceptible for certain diseases. So for identifying the disease pathogenesis, we have done lots of research and found out that certain HLA genes are associated with certain diseases. So let's see them. So HLA DR3, DR4, DR8 and DQ8. So all of these are going to be associated with rheumatoid arthritis and diabetes mellitus. Okay, and this DQ8 is also associated with celiac disease. So remember, in celiac disease we are going to have DQ2 and DQ8. So DQ8 is again related with the rheumatoid arthritis, diabetes mellitus and celiac disease. Then in HLA-B8 we have myasthenia gravis and then Graves' disease. So both Graves are present here. So myasthenia gravis and Graves' disease, they are going to be associated with HLA-B8. While HLA-B51 is going to be associated with Behçet's disease. So Behçet's disease is going to be associated with HLA-B5 and B51. HLA-B27 is going to be specifically associated with ankylosing spondylitis. Then we have Retter's syndrome. Then reactive arthritis. This again is very important. This we also call it as seronegative joint diseases. Okay, so ankylosing spondylitis, Retter's syndrome, and reactive arthritis are going to be associated with HLA-B27. While HLA-CW6 again is going to be associated with psoriasis. So all of these examples are important MCQs here. So apart from this HLA disease pathogenesis, these HLAs are also associated. We also use it for cross matching, for giving grafts. So for cross matching, and also to clear the paternity disputes. So medical legal issues, for that also we use this HLA. Okay. So when you use this HLA for organ transplantation, the most important one for matching will be a HLA-DR more than HLA-B more than HLA-A. So it is in this order we are going to match. So it is very important to match the HLA-DR, then we have HLA-B, then HLA-A. Okay.